Hello and welcome to Indus Nursing Education YouTube channel. Today we are going to discuss about the staff nurse BPS 16 past solved paper from 2023. If you are preparing for the nursing commission exam, this video is for you. Let's get started. First, I need to discuss about the SPSC commission exam. The staff nurse BPS 16 exam is a highly competitive exam for the nursing professional in Pakistan. It's conducted by the Sindh Public Service Commission and Federal Public Service Commission. The exam test is assess your knowledge, skills and experience related in the nursing fields. The past paper from 2023 is a consist of the 50 questions based on the multiple choice question and a best choice question. So let's go through some simple questions. First question is, what is the key element of the personal protective equipment PPE? The option number A, gloves, gown, mask. The B, gloves, detergent, head mirror. The C, BP apparatus, stethoscope and a thermometer. Number D, mask, stethoscope and sanitary kit. So dear friends, the right option or correct option is A. As we know, the personal protective equipment we used in a hospital, especially in isolation wards. So here we will make sure the gloves, gown, mask are the key element of the PPE. The right option is A. Then we have a second number question. Which sexually transmitted infection prevalent in Pakistan? The option number A, HIV/AIDS. Number B, syphilis. C, gonorrhea, and D, chlamydia. So as you know, the common disease in a sexual transmitted is a HIV/AIDS. The correct option here is a HIV/AIDS. The question number 3: what is the most common vector-borne disease in Pakistan? Option number A, malaria. B, Japanese encephalitis. And C, Lyme disease. And D, West Nile virus. So as you know, the vector-borne disease in Pakistan, the most common is malaria. Question number 4, what type of diabetes is the most commonly associated with being overweight? The type 1 diabetes, type 2 diabetes, gestational diabetes, and the latent autoimmune disease, diabetes of the adulthood. So as you know, the overweight or the obese patients mostly likely have the type 2 diabetes. Question number 5, what is common early symptom of prostate cancer? Option number A, weak urine streaming. B, blood in the urine. C, erectile dysfunction. And D, pain in the lower back. So guys, as you know, prostate cancer always obstruct the urine into the urethra and the bladder. So here we will say the correct option is a weak urine streaming. Question number 6, what is a common symptom of the herpes zoster? Option number A, blister on the skin. B, cough. C, diarrhea. And D, fatigue. So as you know, the herpes zoster is a viral disease. So here, and viral disease which mainly affect on the skin of the patient. So the correct option is the blister on the skin. And other options are not related to herpes zoster. Question number 7, what is the measure of the amount of oxygen in the blood? This is a very easy question for you. A, blood pressure. B, pulse rate. C, respiratory rate. And a D, oxygen saturation. This is a basic question. You will get a point when we call the oxygen in the blood, we refer to the oxygen saturation, the term, basic vital sign. Question number 8, what is the definition of the high blood pressure? High blood pressure, question number A, below the 90 by 60 mmHg, and the 120 by 80, and the 140 by 90, and last 160 by 100. So as new guideline suggests that recommended that above 140 by 90 is referred to the high blood pressure. You will think about the 160, above the 160 100, it is also high blood pressure, but we cannot ignore the above the 140 and by 90, option number C. So here is the correct option is a C. Question number 9, what type of food should patient taking during diuretic medication avoid? Option number A, foods high in sodium. B, food high in potassium. C, food high in calcium. D, food high in magnesium. So as you know, antidiuretic medication which release or excrete the urine from the body. So sodium always act as a retention in the water. So here the option number A is correct. So we instruct the patients who are taking the antidiuretic medicine, uh, restrict the sodium in their diet. So option A is correct. Question number 10, what are kidney stones made up of? So here is option number A, calcium, B, uric acid, C, magnesium, D, potassium. So it is a very common, as we will know about the kidney stones, it also made up of the calcium. So correct option is A. What is the most common symptoms of kidney stone? Option number A, back pain, B, abdominal pain, C, headache, and D, chest pain. So kidney pain or kidney stones pain always uh, started from our back, and also we call the lumbar pain, or also referred to a flank pain. So option A is correct, back pain. Question number 12, what is the first step in caring for a patient with a breathing difficulty? So option number A, administer oxygen, B, call ambulance, C, assess the patient airway, and D, patient for pulse, check for pulse. So when you work in your hospital or anywhere, when patient suddenly started a difficulty in breathing, you always assess the patient airway, because in some event also patient airway is not open, and difficulty in breathing is caused by the airway blockage. So you should assess the airway first, then we start the further procedure as guideline suggests. So option C is correct. Question number 13, what is a nursing intervention to help a patient manage breathing difficulty? Option number A, encouraging the patient to remain flat on the bed. Option number B, assisting the patient with using mobile phone. And the C, elevate the head of the bed. D, encourage to drink the water. The nursing intervention help the patient to manage breathing difficulty. It is common practice in a ward or in an emergency or the ICU critical ward. We also elevate the head of the bed when patient started difficulty in breathing. So other options are unrelated. So you supposed to uh, take the C option is correct. Question number 14. What is the purpose of tracheostomy? Option number A, to bypass an obstruct way. Number B, to remove a tumor in a larynx. And the C, to allow for easier swallowing. D, facilitate food intake. So as you know, the purpose of tracheostomy, as we normally taking breathing by mouth and the nose. When the mouth and nose suddenly blocked due to any tumor in the larynx and the respiratory tract, we need to open an other way to breathe out by the patient. So here is a option is correct is A, because we create another way to breathe by the patients to open an obstruct airway. Question number 15. What is the most common position for the patient during meals or oral hygiene care? Option number A, supine, B, prone, and C, left lateral, and the D, upright. When we started the care and a meal, serving a meal to the patient, we always make sure the patient in an upright position, in a sitting position. Like so, option D is the correct option. Question number 16: what position is used to help improve circulation of patient with a lower extremity edema? Option number A is the supine, B the Trendelenburg, and a C left lateral, and a D right lateral. So when patient has edema in a lower extremity, we always elevate the lower extremities area as compared to upper area. So Trenberg position is a position which supposed to elevate the lower extremity, and the purpose of this position is to reduce the edema in lower extremity. So option B is the correct. Question number 17. A patient present a sudden loss of the consciousness and the seizure activity. What is the nurse first action? Option number A, place the patient in recovery position. Option of B, administer an anticonvulsant, call for an emergency or medical services. D, administer oxygen. So here the question mean that a patient present a sudden loss of consciousness and seizure activity. What is the first priority of nurses to take an action for the patient? So if patient suddenly collapse or suddenly lost the consciousness in a place, we supposed to check the place where patient suddenly lost the consciousness. So first we need to take a patient to a safest place, and then we carry out the further options like call for emergency medical services or administer oxygen or anything else. We first need to place the patient in a recovery position. So if there any danger or any traffic like or any water or any electrical place, so we need to place a patient in a safest place, then we started further procedure. So option A is correct. Question number 18, what is the common cause of stress fracture? The single traumatic event, B, repetitive and excessive stress for force on a bone, a sudden increase in a physical activity, and D is osteoporosis. So here question is asking about the stress fracture. So it is a clue for the student who are taking the exam. So here is B option says that the repeated excessive stress force on the bone. So option B is a correct. Question number 19. Which of the following is a foot condition caused by the both nerve damage and the poor circulation in a hyperglycemic patient? And the question is a very clear. Option number A, diabetic foot, B, eczema, and the C, clubbing of nail, or D, deformed toes. So condition caused by the both nerve damage and a poor circulation are hyperglycemic. So hyperglycemic refer to diabetes. So diabetes is a diabetic foot is a complication of the diabetes mellitus. So option number A is a correct. Question number 20. Which specialty nurses have the role to enforce the infection control practices? Option number A, nurse epidemiologist, B, military nurse, C, aerospace nurse, and a D, tele nurse. So here is a question and examiner talk about the infection control practices. So option A is correct, the nurse epidemiologist, because nurse epidemiologist has a role to static of the infectious disease. So they better know about the infection control practices in a community and also implement in the hospitals. Question number 21. The local people's involved community activities is called a co-option, B, compliance, C, consultation, and a cooperation. When we talk about the local people involvement in the community activities, it is always referred to the cooperation. It is important to ensure the local people involvement in the community activities as a very important for the successful implementation of any program in the community. Question number 22. On Maslow hierarchy of needs of the food, water, sleep, and sex are example of A, safety needs, B, self-actualization needs, C, social needs, D, physiological needs. So as you know, the water and the sleep and the sex always refer to the physiological needs because these are also basic needs and it is connected to our physical life. So option D is correct. Question number 23. When all of the physiological needs are met, people become concerned with option number A, safety needs, B, self actualization needs, C, social love belonging needs, D, physiological needs. So, as we understand or read about the Maslow hierarchy of needs, so we understand what the concept of the physiological needs. When physiological needs are completed or accepted, then we think about the safety needs. So option A is correct. Question number 24. Intravenous IV injections are administered at the angle of option number A 40 to 45 angle, and a B 90 to 95 angle, C 15 to 30 angle, and 60 to 70 angle. So it is a basic question regarding our mostly we practicing every day the IV injections or IV cannulations. So we always used at a 15 to 30 angle of degree. Then we continue our procedure of IV injections. So other are the refer to the options subcutaneous injection and the IM injections. So the 15 to 30 angle is referred to IV injections. Question number 25. The MMR stands for the option A is malaria, B mumps, C rickets, and the D measles, mumps, and rubella. So this question is very easy to understand what he says because the D option, only one option, is very close to answer. Question number 26. What is the intervening catheter used for? A catheter type of catheter is used for, so option number A, to measure the blood pressure, B, to remove the fluid buildup, and the C, to administer medication, and the D, continuous drain urine from the bladder. So as you know, in your practice, in a daily life nursing practice, the indwelling catheter is a type of the Foley catheter. So we refer to use, we supposed to use always for the continuously drain urine from the bladder. So option D is the correct. Area around the cell that protect the cell and the cell membrane from its threats of its external environment is option number A, nucleus, B, mitochondria, C, lysosome, and cell wall. As you know, our cell is protected by the cell wall. So option D is correct. Question number 28. The tissues that are associated with the bone of the skeleton, the heart, and the walls of the hollow organ of the body is called option number A, epithelial tissue, B, connective tissue, C, muscle tissue, and D, nervous tissue. The options are the all type of the tissues, but you will find the a tissue which find in the whole body, and the covering of the whole body on the skeleton of the our muscular skeleton muscular, and the heart in the you will find the heart in the heart muscle, and the wall of the hollow organ and the smooth organ covering is also related to our epithelial tissue. So option A is correct option. Question number 29. Which of the following bones are found in the wrist, ankle, and the toes? A sesamoid bone, B, irregular bone, C, flat bone, D, short bones. As you know, the wrist and ankle bones, toes, are the shortest bone of our body. So option D is correct. Question number 30. Which joints allow the movement of the joint forward, backward, and the right to left? Question number A, hinge joint, B, pivot joint, and C, gliding joint, and D, saddle joint. So option C is correct. Gliding joint movement is a forward and a backward and a right to left. Question number 31. The lungs receive deoxygenated blood from option number A, left ventricle, B, inferior vena cava, and C, pulmonary artery, and then D, right ventricle. This is a conceptual question, basic question of the anatomy and the physiology, because always heart receive the deoxygenated blood for the purpose of the oxygenation from the pulmonary artery. As you know, pulmonary artery arise from the right ventricle of the heart, and the right ventricle push blood from the pulmonary artery into the lungs, and the left atrium receive the blood from the lungs and a pulmonary via pulmonary vein to left ventricle. Then left ventricle pump the blood around the body via aorta. Question number 32. What is another name of windpipe? Question number and option number A, lungs, B, larynx, C, trachea, and the D, esophagus. As you know, the windpipe is the most commonly called and the second name of the trachea. Option number C is correct. Question number 33. The exchange of gases between inhaled air and blood is referred as A, cellular respiration, B, external respiration, C, internal respiration, D, circulatory respiration. So option B is correct because exchange of blood and the gases, inhaled gases and blood is referred as external respiration. Question number 34. Which of the following hormones stimulate the release of breast milk and stimulate the contraction of the uterus during labor? Option number A, prolactin, B. Endorphins, C. Encephalin, and D. Oxytocin. As you know, the two hormone of the body produced by our pituitary gland, the secretion we have pituitary gland, only the prolactin and the oxytocin. So their role in a breast milk, the prolactin hormone played a role in a breast milk only, where question about the both. So oxytocin also help in a production of the breast milk and also contraction of the uterus during labor. So option D is a close to correct because oxytocin play a both role and the prolactin also play a role but in only in a breast milk stimulation or production. So option D is a correct. Question number 35. The lower portion of the uterus where the vagina and the uterus meet is called A. Cervix, B. Urethra, and C. Testes, and D. Vas deferens. So, as you know, anatomy of the genital organ of the female, where lower portion of the uterus, where the vagina and the uterus meet, is called a cervix. Question number 36 about the community health nursing. The question is about how many elements are the primary health care. As you know, the primary health care is a basic element of our community health nursing and epidemiology. So here are the option C is a correct because there were a 9 element we studied in a last nursing diploma. So where we study the 8 elements, but in the current states, indicator shows that the 9 elements of the primary health care. So option C is a correct. Question number 37. Which of the following diseases is transmitted due to drinking contaminated water? Option A, Salmonella typhi, and B, the dengue fever, and C, the tuberculosis, and D, pertussis. It is a very common and easy question for you because Salmonella typhi is only bacteria and the bacterial disease which found in a contaminated water and the food and also growth in our intestine. So we always refer the drinking contaminated disease is Salmonella typhi. The question number 38, the power of resistance of the body is called A. Subunit vaccine, and B. Immunity, and C. Vaccine, and D. Polio vaccine. So the most common and simple definition of the immunity is power resistance of the body. So option B is correct. Question number 39, tuberculosis TB is caused by the type of the bacterium called the option A is a fusobacterium, and the B bacterium Brodetella pertussis, and a C mycobacterium tuberculosis, and D latent or active TB. So this is a very common and most repeated question of the SPSC staff BPS 16. So the basic question answer is the mycobacterium tuberculosis. The option is C is the correct. The question number 40, the term EPI stands for. This question is a very tricky. But after this video, you will familiarize the tricky question. So option A is extended program on immunization, and B extended program on immunity, the extended program of immunization, D express program in immunization. So here you will find the option A and the C very similar, very resemble, because here is the only difference of on and off. But the correct option is A, extended program on immunization. That's it for today's video. I hope this analysis of the staff nurse BPS 16 solved past paper from 2023 is very helpful for you. Don't forget to subscribe our YouTube channel for more videos on nursing and exam preparation. Good luck for your commission exam.